Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. How embracing social media mindfully can lower stress. Young people's mental health may depend on how they use social media rather than how much time they spend during it, according to a new study by University of BC researchers. The research published in the Journal of Experimental Psychology journal examined the effects of quitting social media versus using it more intentionally. The results showed that users who thoughtfully managed their online interactions as well as those who abstained from social media entirely saw mental health benefits, particularly in reducing symptoms of anxiety, depression, and loneliness. With social media use nearly universal among young adults, especially those ages 17 to 29, concerns over its impact on mental health have grown. In the 6-week study, 393 Canadian young adults with some mental health symptoms and concern about social media's impact on their mental health were split into 3 groups. A control group that continued their usual routines, an abstinence group asked to stop using social media entirely, a tutorial group that was coached in intentional usage. The tutorials guided participants on fostering meaningful online connections, limiting interactions that encourage self-comparison, and carefully selecting who they followed. Both the abstinence and tutorial groups reduced their social media use and experienced fewer social comparisons, a common trigger for anxiety and low self-esteem. But the tutorial group didn't cut back on social media as much as those who tried to abstain completely. They reported notably improvements in loneliness and fear of missing out. The researchers used an approach with the tutorial group that emphasized quality over quantity in social media interactions. By muting or unfollowing accounts that triggered envy or negative self-comparisons and prioritizing close friendship, tutorial participants built a healthier online environment. Rather than passively scrolling, they were encouraged to actively engage with friends by commenting or sending direct message, a behavior that tends to deepen meaningful connection while helping users feel more socially supported. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.